90% of the time, when I have someone come in with hip pain, it's because they lack range in 3 areas. Today we'll look at those and get those taken care of. You use a lot more rotation in your hips in daily life than you realize. If there's a restriction, you'll start moving in weird ways to make those motions happen, and your hips will start to ache. To test for hip rotation, I want you to lay on your back. To test external rotation, I rotate my leg in towards my body without having to crank or move anything besides my hip. The norm is 45 degrees. If this is a 0-degree angle and straight to the side would be 90 degrees, then halfway in between is 45. Now that's not as important as seeing if there's a bigger difference between you and yourself. That's what I'm more concerned about. How far can you pull your leg compared to how far you can move your leg on your own? If there's a big difference, then that's a limitation in external rotation. Let's check internal rotation. You start the exact same way, and now you're rotating out to the side. The same number is 45 degrees. If you're tight, you're gonna feel like you're about to cramp in a muscle right up here on the front lateral side of your hip. So if that thing immediately cramps, that alone tells you that you're limited in hip internal rotation and could use some work there. This one's a little bit harder to crank yourself because it forces you to have to crunch up a little bit, but you can still do it. See if there's a major difference between your arms versus your leg when you try to rotate it internally. The nice thing is there's a single exercise you can do to help with internal and external rotation at the hip. Now this is something that's been very effective for me in the clinic with my patients. This thing is called a super band. It's a super thick but still elastic band. This is gonna go right in the hip joint, right up in your hip joint, as far up as you can, right up in that groin area. I'll usually use a pillow or a foam pad or something for the opposite knee. The key is to get really good tension on this band. What that does is creates a little bit of what's called a distraction in that joint. You have your femur and your acetabulum, so your hip and your thigh bone. It's basically giving a little bit of space between the two, so that way it can rotate without getting restricted in the joint. There's a neuromuscular response that happens when you do a distraction with movement that will immediately give you gains in rotation actively after the exercise. You take your hands and you push the knee in. So my hands are doing the work here. I'm pushing my knee in. That's internal rotation now. And then I'm actively opening up my hip, squeezing my glutes on that side to try to open up my hip. So that's 1 rep. I would do about 15 of these, where each time I'm holding about 2 to 3 seconds each direction. After I do about 15 of these on each hip, I would lay down and retest to see if it feels like I've gained motion. Now personally, my hips were already pretty mobile, but even then this still feels better on this leg after I've done that exercise. That alone is something that's great for a warm-up at the gym, for example, because it gains you the motion so that way you can utilize it when you're lifting. But if you want that thing to stick around long term, you have to strengthen the muscles that make that motion happen now that you have the full range. The way you do this is 2 exercises. They're called clams and reverse clams. For clams, you lay on your side and you're raising this hip up as far as you can go and down. Each rep, I'm trying to get a little bit higher without rolling back. As soon as you roll back, you're taking away the work from the musculature here that creates that rotation, and you're throwing it to your low back. I would do 10 reps, and you should really feel a burn in that back side of your glute. For reverse clams, you'd put a pillow here between your knees just to give you some space that better aligns that hip joint on that upper leg. You're rotating the opposite direction. Your body's gonna wanna roll forward to make you feel like you got higher. So you have to stay stable here again, and people will crank their ankle to feel like they're getting higher. I want that thing to be relaxed. So while you're here, you would do 10 to 15 reps where you're pushing into it for a few seconds, trying to get higher with each rep. That's gonna hit that muscle that might have felt like it was gonna cramp earlier. That gets better over time as you bring function to this muscle. We still have to talk about extension. You're gonna lay on your stomach, you're gonna lift one leg straight off of the table and see what that feels like to you. What you're looking for is feeling it in your glutes rather than primarily in your hamstrings or your low back. If that hurts your low back, that alone tells me that there's probably a lag of extension there. First step, like we did with rotation, is mobilization with a band. So you take that same band and you're getting it up just below your glutes here. So right on your sit bone, that's where you want this band to be. The leg that was tight is the one that you want on the ground. What this does is create an anterior glide. That's what needs to happen when you extend your hip. It needs to glide forward or anteriorly. What you do is you hinge back, and when you go forward, you're tucking your pelvis, so you're trying to roll your hips back until you feel a really good stretch on that anterior or front part of your thigh and the musculature there. So it's here, hold for about 3 seconds, and you would just perform about 10 to 15 of those, where each time you feel that good stretch on that front portion of your thigh. Then you would get back on the table, you'd retest and see if it feels better. If you were able to get higher with less pain, that means that that was good for you. There's 2 ways we can capitalize on that with strength. You would lay on your stomach and you would bend your knee like this, and then you would lift up that leg, pain-free, hold for 5 seconds, and then come back down. You would do it 10 times, so it looks like this. That really hones in that glute to be the primary driver of hip extension. Now, if you're still not quite ready for that one, if it hurts, you can do a glute bridge, which is where you lay on your back, your feet are here, you squeeze your glutes, and then drive up to full hip extension. Don't overarch your low back, you just want this to be flat all the way through, like this. So you lock out your hips, don't overarch your low back. You would do about 10 of those, really honing in on squeezing your glutes. You should feel the burn in your glutes, not your hamstrings or your low back. There's one more thing we need to check to make sure that your hips aren't tight. It's a special test in physical therapy called the FABER test, F-A-B-E-R. It means flexion, abduction, and external rotation. It's actually testing the combination of extension and external rotation. To test it, you lay on your back, you bring one ankle right above the kneecap, not on it, but right above it on your lower thigh, and then you try to let that leg relax as much as it can and see how far out your knee drops to the side. The big thing here is seeing if you feel any restriction in that front portion of your hip and seeing how high it is, testing the other side, and seeing if there's a major difference between the two. The one that's higher needs some work. This exercise is called the lateral hip shift. You're in a half kneeling position, which means one knee's down, one leg's up. Your chest and your hips are staying facing forward this whole time. The leg that was tight is out to the side. It doesn't have to be straight out to the side, anywhere from 45 to 90. I usually stick around the 60-degree angle here. You are actively trying to open up your hip, kind of like we did when you had the band there. You open up your hip, squeezing your glute, and then you're shifting into that leg until you feel a stretch in your groin. Hold about 5 seconds, and then you come out of it. But if you don't quite feel a good enough stretch, you can hold this here just as a lever arm. So I'm not tensing at all, it's just a grip. I'm just holding this here and then add some weight to add that deepening stretch. So I open up that leg, I lean into it, and there I feel a really good groin stretch, 5 seconds, and then I come out of it. I do about 10 reps of this on this side that was tight. If they both felt tight, you do it on both sides. You would get back on the table and you would retest that FABER position to see if it helped. And I'm letting my knee on this side drop as far as it'll go naturally and seeing if that feels better or if I get closer to the table with that knee without having to drive it down. If that helped, then you know that that would be a good exercise to add in as well to increase that combination of external rotation and extension. If you have pain and aching in your hips, I would highly recommend finding what's tight and doing the appropriate exercises 1 to 2 times a day. You'll get to a point where you don't have to do it that much. It'll be more of a maintenance thing that you can trickle into your workouts. Now, if you're looking for the next step where I add in hip stability, check out this video here where I go more in depth on how to stabilize those hips and take advantage of that new range.